of Salma Bafagih, doing her Master's of Health Sciences in Community, Public and Population Health at Ontario Tech. And the title of her presentation is What is on Your Plate? Examining Predictors of Food Literacy Among Canadian Adults.
Hello? Okay. Imagine this. You're in a grocery store and you pick up a food product. Do you know how to read its nutrition label? Can you tell where it's from, like spotting Product of Canada somewhere on its package? Do you ever think about how its packaging may impact the environment? Now, picture yourselves making dinner. Do you know how to cook a meal from scratch? And as you scroll along through social media, how can you tell if that influencer is actually giving reliable nutrition advice? All of these questions relate to different aspects of our food literacy. Food literacy is the knowledge, skills, and practices that we use within our situational and our social contexts to make our food choices. It explains how we can understand, evaluate, and actually interact with our food environment. Now, let's reflect on what else we know about food literacy. Some studies have looked at food literacy in specific groups, like parents, and they found relationships between food literacy and better diets. Others have looked at its relationship with gender, but they haven't considered other life factors like ethnicity, education, geographic location, or income. But here's the shocking part. Can you believe that no studies have looked at food literacy or its predictors on a national level? In other words, we still don't know how these different life factors can influence levels of food literacy. Why do we care? Nowadays, you don't have to walk too far into a grocery store to see the aisles of packaged and processed foods. This change in accessibility within our food environment has actually shifted consumer behaviors, and Canadians are now eating diets that are high in saturated fats, sugar, and sodium more than ever before. And it's costing us. Not only are diets high in these nutrients a leading risk factor in heart disease, diabetes, stroke, and cancer, but they are draining $13.8 billion from our healthcare system every year. If we don't focus our efforts on investigating food literacy and its predictors, how can we create effective programs to improve Canadian diets? Well, that's where my research comes in. Using data from the Canadian Nutrition and Health Survey, I'll conduct a cross-sectional study among a diverse sample of Canadians across all provinces and territories. First, I'll use a validated tool to score food literacy. Then I'll analyze these scores with the life factors I mentioned earlier and see which ones are strong predictors of food literacy. With these insights, we can do more than just study food literacy, we can take action. This data can influence change on the policy level so that we can create equitable programs to promote healthy eating for those at risk. Improving food literacy will promote sustainable eating and ultimately improve health outcomes. So, what's on your plate?